We've already outlined in earlier sections how to stay sexually safe and healthy, and you should really try to stick to those. But here's some more information about what to do should something go wrong.
We totally understand that accidents happen, and in times like those, you want all the real helpful information you can get.
If for whatever reason something unsavory happens, like you get an STI or somebody gets pregnant, it's best to take care of things quickly and make decisions fast. And to think of yourself and what makes most sense for you, and not what your parents think, or your church thinks, or what Dr. Phil thinks, or what your cat thinks, or what Oprah thinks, or anybody really. It's your life. If you think you might have an STI, you should go get it checked out by a doctor ASAP.
Just because you don't have crabs in your pubic hair or some other visual symptom doesn't mean you don't have an STI.
Really, if you've had unprotected sex with someone whose STI status was not known to you, you could be at risk. So it's best to simply go get it checked out.
All STIs can be treated, and most of them can be cured.
If there is any possibility at all that you have an STI,
do not have any more unprotected sex until you know what the F is going on.
Also, don't lie. If someone asks you if you're clean and you're not completely sure if you are, tell them that. They deserve to know.
If you've had unprotected sex and you're worried about a possible pregnancy, you should look into the morning after pill, or Plan B, which you can get at pharmacies and also Planned Parenthood and other women's centers.
The biggest question of all is, how do I know if I'm pregnant? Well, that's a really hard question to answer. If your period is late, whether it be 2 days, 5 days, 500 years, you should probably get that checked out.
What, you mean late for an appointment or something?
Then you should probably grab a pregnancy test. You can get them at your local drugstore, or women's center, or from your mom.
If you're a girl and you find out you're pregnant, you have no obligation to tell the guy. However, take into consideration his feelings, his involvement, and the repercussions of the situation.
If you're a guy and you have sex with a girl, and later she tells you she's pregnant, you should probably sit down and have a talk with her. Please?
If a pregnancy occurs, you have one of two choices that you have to make first. One is to keep being pregnant, and the other is to terminate the pregnancy.
If you decide to remain pregnant, you will need to choose between parenthood and adoption. If you decide to terminate the pregnancy, you will need to get an abortion.
These are all valid choices, any of which may be the best decision for a woman at a given time.
No one of these choices is easier or simpler to make than another.
Having an abortion is a really big decision for anyone to make. Here's an outline of the two most common methods.
If you've been pregnant for 9 weeks or less, you can get an early medical abortion.
This procedure can be done at home.
You're given a pill to swallow, and then 36 to 48 hours later, a tablet is placed into your vagina.
These two drugs will terminate most early pregnancies within the next 4 hours.
It feels like having a heavy and painful period, but it is quite safe.
The second method we'll talk about is called vacuum aspiration. I know, not the greatest name, and can be performed up to the week 13 of pregnancy. You will need to make an appointment at a women's center or clinic. They will provide you with a plethora of painkillers. However, the actual discomfort you feel during the procedure will depend on your own pain tolerance. A vacuum tube would be inserted into your uterus. Don't worry, it's only up there for about a minute, and recovery time is generally only a couple of hours.
These two types of abortions are very low risk,
But they do cost $400 to $500, so they're not exactly a low risk to your wallet.
and should have no effect on a woman's ability to become pregnant in the future.
You're probably worried about your privacy in all of this. Know that there are resources available to you, depending on your state, in which you can remain anonymous. Use the internet, it's your friend.
Well, product condoms, they don't break, and plus they have really cute rhinestones.
The only time I've had a condom break, I don't know if this is common or not, but it actually felt like a balloon was popping inside of me. But it wasn't horribly painful, it was like a little pinch and a pop, and then we knew we were in trouble.
The best advice I can give you is when you're taking off the condom to give it a quick look over and make sure that everything is still in order. And if the condom does break, to check your penis for spikes. And if you do have spikes, then it might not be the best idea to even use a condom. In fact, you might not even want to have sex at all. In fact, you might be a tomcat. I'm sorry.
If by swallow you mean with your vagina, then yes, there is a possibility that you may become pregnant. There's a possibility that you may become pregnant from sitting on a boy's lap if you are both naked and his penis has been inserted into your vagina. If by skin you mean the vaginal canal, then yes, it is indeed possible to become pregnant. I think the real question at hand is, you do understand that there isn't actually a cherry down there. If boobs are a euphemism for your vagina, and if by kissing you mean the insertion of his penis into the aforementioned orifice, then it is indeed possible that you may become pregnant.
Wait, is it on? Yeah. Okay.
Badminton.
I'm mustering up acting skills.
Okay.
Is that long enough?
Yeah.